Well, thank you very much for joining me today, Wayne. Really appreciate your time. We know it's very busy for you and for the work that you're doing with Health Bridges. So to start off, could you introduce yourself, the work that Health Bridges does, and where you work in Peru?
Sure. I'm Wayne Centrone. I'm the founder and executive director of Health Bridges International. We're a not-for-profit based out of Portland, Oregon, and Lima, Peru. We work in a number of different departments around the country of Peru. And in fact, we work in every single department, all 26 of the departments of the country, with various programs and projects. Our work is really focused on two things: developing models of care delivery for marginalized women and children, and helping to evaluate and then prove the evidence base of those models, and then working to deliver health services around areas where healthcare professionals, physicians, nurses, midwives, find information they need to be able to save lives. And we do that in a number of different ways through collaborative partnership.
Yeah, that's fantastic. And obviously, we work together on the work that you're doing in Peru on an anemia project, and really see the work that Health Bridges does in the community and the collaborative approach that you take. And I think right now, in such an unprecedented time, collaboration and evidence-based solutions are very, very important. So uh, thank you for sharing. And can you talk a little bit about what the situation is like in Peru right now amid COVID-19? And what are some of the impacts you're seeing on a community level?
The reality is that people who are vulnerable before disasters all caused situations in the world are even more vulnerable after those situations and emergencies and disasters. And what we're finding in the populations that we're called underserved is that they are now more disconnected from the resources they need. They're more disconnected from the services that help to provide care for their child that's living with a disability. They're more disconnected from access to advocacy and the services that they were receiving that were allowing them to start to build the lives that they envisioned for the future. So what we're trying to do is quickly overcome those gaps by building small bridges. We're sending teams out where appropriate. We've been fortunate. We've been able to get humanitarian licenses that allow us to go around inside the country. And we're sending teams that are doing house calls in the community. We're on daily calls. We've set up social media accounts so that we can stay in contact with everyone. And what we're finding is that more than anything else right now, people, they need to know that they're a part of something bigger than what's going on around them, that they haven't been forgotten, that they're not lost, that they're not a number that was being counted on a spreadsheet, that they're a life, and that the hand that we reach out is a hand of support, but more than that, it's a hand of a relationship. And that's what our work is right now. And I overheard someone say the other day that, they were talking about how much extra time they felt they had on their hands and how they were, more time to cook in the kitchen. And oh my goodness, I think our team now is busier than we were before. It's unbelievable. I was talking with our in-country coordinator, and she was telling me that on any given day, she's on the phone for 10 hours a day, vetting phone calls, talking with clients, making sure that the partners we work with in the field are connecting into resources so that we can get a sum of our parts impact from the work we're doing. And I don't know how long this will go on, but I'm not sure that she can continue talking 10 hours a day on the telephone.
Yeah, that's definitely fair. That's a lot of time. And we're hearing that from a lot of our partners around the world, that this is actually the busiest time. And I think one thing for certain is we know that this pandemic is impacting everyone around the world, but differently. Geography can play a role in that globally, but also urban versus rural settings,
Most definitely.
and socioeconomic status plays a huge role. We're seeing that where we work in Canada, and we know that that exists all around the world, that there are very different realities that people are facing, and some communities have more support than others. So it's fantastic to hear about the work that you're doing to keep people engaged, to feel informed and cared for. I think that's really important. And do you have an idea at what you think some of the longer term impacts from a global health or nutrition perspective might be from COVID-19 when we move hopefully towards a post-COVID world?
Yeah, that's a great question. No one's immune to this, right? Well, all 7.5 billion people on this planet are impacted by this. There's never been anything like that in modern history, and perhaps in the world, of such a tremendous impact at so many layers in every life affected. And for the vast majority of people that are feeling this impact directly in their lives, the level of stress and the level of tension is just elevated. And there's a natural level of stress that exists by living in the experience of poverty. There's a natural level of stress that exists from being disconnected to a resource that you need. There's a natural level of stress when every day is a struggle or a strife. And now add on that higher levels of stress. And so what we're seeing is that people who here before didn't have access to mental health services are desperately in need of mental health services. And we're already thinking to ourselves, what kind of bridges can we build to help to fortify mental health services? We know that people are disconnected from food, and there are micronutrient deficiencies, iron being one, that impact immunofunction. And for people who've been chronically malnourished, chronically undercalorified, now having this extra stressor on them is creating even more challenges for keeping their immunofunction well, and beginning to fortify what we hope to be another phase of their growth and development once this is all over. So, we have to start thinking, how do we help to fortify nutrients, calories, access to all kinds of supportive and, life enriching services for underserved populations, not just now, but well into the future.
Yeah, I think that's a good point. I think globally we're going to see impacts on mental health and nutrition for the long term. So
Most definitely.
really happy and encouraging to hear that you're thinking of that now, and how you address those concerns and very real issues in the community. So I want to thank you, one, very much for your time today. I know you're
Thank
quite
you.
busy, and thank you for the work that you and your team, both in the US and Peru, do on a daily basis.
Thank you.
And my final question is, if there's one thing that you would like Lucky Iron Fish followers and supporters to know about the work you do, and how they can learn more or support what you're doing.
Well, that's very generous of you. One way that folks can learn more about us is to go on our website. Although websites they're not as dynamic as we would all like them to be. They do possess a gestalt of who we are as an organization, and I think we've done a pretty good job of at least giving people enough information that they might be able to ask us a question. So first, go on our website. Second, contact us. We are very interested in being in collaboration, and that is with all level of stakeholder and all level of partner. And I guess the last thing is, no one organization, no one group can expect to be able to really respond in the way the world needs. And what we hope is that we can continue to be in partnership with organizations like Lucky Iron Fish, and with the multitude of service-oriented, dedicated change agents that the world needs right now, leading with social justice and representing communities with their involvement. And I hope that the one thing that comes out of this is we all realize how connected we are, and we all realize how much when we work together, we can truly affect change.
Yeah, definitely. I think, like I said earlier, and the work that you do, collaboration, now more than ever is going to be so important. So thank you very much. We will
Thank
link
you.
to your website and your social media posts.
Great.
But
Thank you so
thank
much.
you. Thank you very much. We really appreciate your time, your dedication, and the work that you do. We've seen firsthand how impactful Health Bridges International is in the communities where you work in Peru. So thank you.
Thank you. It's been really delightful.